The developmental individual difference relationship model was developed by Dr. Stanley Greenspan and Dr. Serena Wider. This model is used for evaluating and treating developmental delays, specifically those of autism spectrum disorder. The three components addressed in the DIR consist of the child's functional, emotional, developmental level, the child's individual processing profile, and the relationship between the child and their caregiver. The caregiver or parent broadens their child's communication abilities by meeting them at their current level and determining the possible strengths that could be enhanced to improve their current developmental delay. With the DIR approach aiming to improve the child's language, cognition, emotional, and social skills through meaningful interactions, the Floortime component comes into effect. Floortime is the play element of the DIR approach that consists of the parent or caregiver physically being on the floor with their child and playing with them. The parent is instructed to follow their child's lead while observing and learning about their child's strengths and limitations. The parent is trained to challenge the child's usual behaviors along with demonstrating and encouraging suitable play and social communication that requires interactive involvement from both the parent and the child. There is support for this approach. However, the evidence supporting this is based on the participants and their outcomes. The participants and the outcomes of many studies about this approach state that the DIR Floortime approach demonstrates improvements on almost all aspects of what they are primarily trying to improve: the child's language, cognition, emotional, and social skills. Although the studies consistently support that the child demonstrating the most improvement are those of milder and less severe cases of ASD or other developmental delays, in many cases the caregivers were the mothers. A vast majority of the mothers participating in the studies had education beyond high school, even beyond a bachelor's degree. Also, all of the mothers were married and many of them had other children and were not employed outside of the home. With such participants, it is obvious that the mothers implementing the therapy to the children are able to spend a large amount of time with them and are also well-educated role models. Another aspect that can affect the outcome of the therapy is that the mothers were volunteering to implement this to their children, along with them having the drive to improve their child's development. Not only do the child's caregivers' characteristics and abilities play large roles in the outcomes of the DIR Floortime approach, so do other services being provided to the child, such as occupational therapy, speech-language therapy, preschool, or special education. The results are not supporting the DIR Floortime approach specifically. They are also supporting the other services that are being provided in conjunction with the DIR approach. It is unknown and unmeasurable if the DIR approach itself is helping the child improve, or if it is a combination of all intense interventions being provided along with the simple yet complex interactions between the child and their caregiver. In many cases and studies, the data gathered was based solely on what the parents reported about their child's performance. Sometimes the caregiver would have to learn other techniques to implement because they would not be able to get their child to interact in the way that they had hoped. The data collection is also unable to be verified for reliability because the outcomes were unable to be measured due to the wide variety of individual neurological processes. When it comes to data collection of this approach, it is too difficult to narrow down exactly what may have caused the child to improve. It is also difficult to determine the amount of required training that is needed and what level of intensity is required yet appropriate to demonstrate substantial improvement. With this approach being so focused on relationships, it seems as if the only relationship it is truly strengthening is the child and their caregivers. With this relationship being extremely important, so are other relationships, including other children their age, their other service providers, and teachers. It is important for the child to build relationships outside of the home because they need to be able to function in everyday life, including school and other social environments. Even though the relationships mentioned Even though the relationships mentioned are very important, it may be easier for the parent to sit down for an extended amount of time and implement the approach with their child than a teacher. While at home, the child is the primary focus, while at school, in the classroom, the teachers are unable to conduct one-on-one interaction with every child, resulting in the child, usually with the developmental delay, falling more behind. It could be difficult to implement this approach outside of the home without the mother or primary caregiver present. Coaching of the parents is one of the main components that make up this approach. There is a professional interventionist that will train and coach the parent. This interventionist could have anywhere up to 25 hours or more of intensive and structural training along with other informational training resources. While they have such an abundant amount of training, the caregivers may only have a few hours of training from watching the informational DVD lecture of the play project, along with possibly going to a few-week program, a few hours per week. For the beginning sessions, the parent is supervised and given feedback on their performance and interaction with the child. However, the supervisor is not always there, meaning the parent will not always be given feedback. Researchers say that coaching needs to be better in a number of ways, such as more time being devoted to coaching the parent or caregiver in order to change the parent's ways of engaging, relating, and communicating with their child. Not only is it an intensive approach for the child, it also is for the parent in order to help the child reach their most potential. With play being one of the most important and complex actions a child can participate in, it is extremely important to focus on building the area of social participation among a variety of environments, especially those with developmental delays. Due to the lack of randomness among the participants, unreliable data collections, and inconsistent reasons of improvement, this approach, in my opinion, would not be the best choice due to the wide variety of possibilities of why improvements are being shown, along with improvements not being shown across all severities.